first speaker is Dr. John Davis Akkara. He's a glaucoma consultant at Chaitanya Eye Hospital Kochi and Western Eye Hospital Kochi, and he'll be elaborating on the pros and cons of joining a private institution versus an own setup. Thank you.
Thank you, Dr. Raki. Thank you to KSOS for this invitation. So there's no financial interest. Firstly, my background. So MS Ophthalmology, Glaucoma Long-Term Fellowship, phaco training. I was a consultant at DNB Institute, Little Flower for 2 years. I was a faculty at Medical College, Sri Ramchandra Medical College for 2 years. And now I am in private institute and also my family's practice. So not exactly solo practice, but solo practice with a backup. Whom is this presentation for? It is for PG residents and for fellows. This is for private institutes. So those who are planning to join a private hospital or start their own private hospital and considering the various options available in private practice. Okay. So firstly, you have to have your goal in life. It's not just about what is best. It is what is best for you. So if you have a particular specialty, you have to think about that. Suppose you are a vitreoretina surgeon or you are an oculoplasty specialist. You have to think about your where you'll be practicing, whether you'll be practicing that specialty more. Do you want to practice general ophthalmology and with a bit of that specialty, what do you want to do? And whether you have to go back to your hometown if you have some commitments there, where you are planning to settle down. If you are looking for some other place to settle down, going to a metro, going to a tier 2, tier 3 city town, whether you are willing to relocate, whether your spouse and children are also willing to relocate, and whether your parents, your spouse, your children, they have some opinions on where to settle down, where do you want to work, how long you need to work. You have to consult your parents, spouse and children as well. And of course, you have to think about your need to learn, how early you have to start earning, whether you can wait while you study for some more time, whether you can wait while you build up your own private setup, whether you have to start earning from the time you just finish your PG, all those things. Then of course, money, comfort, recognition, which one you want more, which one you definitely need more, whether you need just a bit of everything or you really want a lot of fame and recognition, whether you want a more comfortable life, whether you want a lot of money, all those things matter. So it is not a one thing fits all. It's everybody has their own thing for this. Okay. So as a specialist with a fellowship, what are your options? As a specialist, most people assume that once you finish your fellowship, you are ready to start. But it's not always like that. You might have to stay back in your hospital. You have to stay back in the hospital where you trained and get some more additional training. Because as a fellow and as a medical officer, what you learn is not the same. You will definitely learn more as a medical officer. You can also if you want to, you can join a practice, you can join a hospital or a chain where you will be a junior consultant and you can keep learning. So look for a place like that. Some people who are more adventurous, they can actually start building their own solo practice immediately, but it comes with its own difficulties and also its own advantages. Or you can go freelancing. So freelancing is for people who can manage their time and commitments. So you'll have to talk to a lot of people and find freelancing gigs at different places, and you have to juggle all those by yourself. And of course, government, trust or NGO hospitals is a different genre. If you want to go in that route, that is also possible. Of course, if you want to join an established practice, you go and find an established practice which is doing well, and or an established surgeon who is doing well. Talk to them, and most often they will want you to join full time. So you have to speak to them and think of the terms and conditions, whether you are allowed to have your own setup, whether you are allowed to work in other places also part time. All those things have to be discussed at the time of joining there. And advantage of joining an established practice is you get adequate volumes from the beginning. If you start your own private setup, your own solo practice, you will have to build it up over the years. And when joining a private practice, you have a reasonable amount of freedom, but with some restrictions. And if you want to take a break, if you want to take a leave, you have to discuss before joining what are the commitments there. You can typically join without any investment, but some places allow you to buy in to their practice also. So with an investment is also possible. You get a good remuneration by joining a private practice. And the advantages, of course, you can get to see and learn how a successful private practice works. So if you want to start your own solo setup, you have to first join a private practice and learn how it works. It is kind of a super fellowship. After you learn the theory of your fellowship, you can learn how a hospital works. It's an administrative fellowship of some sort. You have to you get assured numbers and cases, and you get a fixed income, and you get to learn how a hospital works, and you have to keep your eyes open for that. You get good work experience by working in good hospitals, and it looks better on your CV as well if you're planning to join a better hospital, or if you are planning to start your own private practice. That also works out. And of course, you will have to look at all the you don't have to look at any of the instrumentation, the quality, the contracts, maintenance, and all that. How much time do we have? So all the equipment maintenance, everything you have to look at. So joining a practice, you have some disadvantages because you're working for someone, and there are targets and working hours from them, and you are just one among many. Patients come to the hospital not for you, and there is a ceiling to the earnings. That is also have to discuss when joining. As a solo practice, it's like you can actually join as you can start just a private practice with or without an operating room. It is often easier to go to some other operating room while having your own private clinic, and later, once you are well established, start your own operating room. And you are the primary eye doctor. You have to look at every eye disease. It's not like you specialize only in what you know. If you are planning solo practice, you are not a super specialist, and you have to have manage other visiting consultants. And of course, the advantages, you have the freedom to choose how, where, what, and when you practice. You are your own boss, but that also means you have to manage everything, and you get higher earnings over a longer period. You get much higher earnings than joining somewhere else, and it is the most rewarding but also the most challenging. Lot of disadvantages: the investments, the staff management, finding the staff, long incubation period, and also you cannot restrict to specialty. As I said, if you go for a conference such as this, you will have to close your clinic for that time. So you will have a lot of restrictions on yourself set by you. You learn from your own mistakes. You cannot learn from others, and there is no backup, and everything you will have to consider whether you have to refer out if required, and every machine upgrade is going to be expensive. And the challenges you look at is the location. You find out where you're going to practice, whether it is feasible to start a solo practice there, how is the competition. If you're going to start somewhere where there's already a lot of competition, it's not going to build up in a short period of time. And you need adequate financing and equipment and staff hiring, and you have to figure out the right timing to set it up. Immediately after finishing your PGR fellowship may not be the right decision, and it's permanent. Once you start a private practice, it's very difficult to go back to joining a private hospital, or even to go back for some training, and your specialty will suffer. You will be a general ophthalmologist with a specialty, and so it is not for everybody. You can also do freelancing, and that is a different genre. So I'm going to conclude with this. So if you're joining a private practice, or if you're joining this your own setup, if you're starting, you have to think, discuss, and decide with the family, mentors, and friends. And one stage is a stepping stone. You go to join a private practice and then start your own practice. And of course, you need long-term persistence, and you have to have your short-term and long-term plans. And don't forget to have fun, because once you start something, it is difficult to forget that you also have to have fun and enjoy what you do. Thank you.
Thank you,